Today, we're going to go over some exercises for wrist pain, specifically wrist tendinopathy. So if you have arthritis, if you have broken bones, this is not for you. Check out my last video in terms of wrist pain and its treatments. So it's going to separate into 3 general sections. The first one is just warming up for range of motion exercise. Second is stretching, and third is strengthening. You should move on to the next sections only if the last section was relatively pain-free. Starting with range of motions, we're going to use my right wrist today, but you should target both wrists, if not the ones that is affected today. In terms of tools, I prepared 3 things. You can use a little hammer that you have at home, a little water bottle, for me it's ultrasound gel, as well as a little socks, or if you have a stress ball. Starting with range of motion. First thing, so there's 4 type of range of motions. I want you to flex your wrist all the way down, just leave it on its own there, hold it for 10 seconds. Say 10 seconds has passed, you're gonna do it 3 times. And then wrist extension, same thing, you're gonna hold it there for 10 seconds. Come back, you're gonna do it 3 times. And then you're gonna do ulnar and radial deviation. I'm gonna bring it this way. So ulnar deviation, it's like you're wiping a windshield. So you're gonna leave it there for about 10 seconds. You're gonna come back, and then radial deviation, easier this way. Okay, you're gonna bring it down this way, 10 seconds, bring it back. You're gonna do 3 for all of these. You can do it pretty pain-free. Next, we're going to do some stretching. So you can use your other hand to help you with this. With wrist extension, go ahead and extend it that way. Bring it back, 30 seconds this time. You're going to do it twice. And then down this way, 30 seconds, and twice. Now, if you're able to do that relatively pain-free, next we're going to add some weight. So find a little nice table or a little chair. Go ahead and put your weight on it. Okay, so weight onto your wrist. It's kind of like you're doing a push-up. You could also find a wall, do similar things. You're going to do a wall push-up sideways. Okay, wall push-up sideways. Okay, you want to hold it there for about 30 seconds. You're going to do it twice. And when you're ready, this one's a little more difficult. You're going to go wrist flexion. You're going to add some weight, but don't lean on it completely if it's causing some pain. You're going to hold it there for 30 seconds. Twice as well. Once you're able to stretch and do it pretty pain-free, then it's time for strengthening. And like we mentioned in the last video, strengthening is especially important if you're using your wrist in your everyday job. You can't avoid it. You want to strengthen your tendons to the point that it can accommodate any activities. But you shouldn't do this until your pain is completely died down. So there's 2 types of strengthening exercise. First one is isometric. It's better because we're adding tension to the muscles without shortening or lengthening it. And then you have the dynamic exercise, the isotonic exercise, where we're not really adding a lot of tension to the muscle, but we're changing the length of it. So we're going to go back to our tools here. With your water bottle or whatever that you can hold, or if you have a little tiny dumbbell, you're going to bring your wrist up like that. You're going to hold it right there as an isometric exercise. Hold it there for 30 seconds. You could do it on top of a table if it helps you. 30 seconds, bring it back. You're gonna do it again. 30 seconds has passed. Okay, now wrist flexion, same thing. This time you're gonna bring it up, hold it 30 seconds, and bring it back. 30 seconds, and bring it back. Onto the hammer. This is gonna be very important when it comes to rotation. So you're going to hold it onto the side like this. You're going to do forearm pronation. Hold it there, 30 seconds. Kind of keep your elbows tucked in. And then back. Supination, 30 seconds. Only if you're able to do it pain-free would you do isotonic exercises. Okay, now these are pronations of the wrist. Now we want to do ulnar and radial deviation. So just like you're holding a dart, you're gonna hold it like that. With your other hand, you're gonna add some resistance. So you're trying to work on your ulnar deviation. So you're pushing back onto your wrist and holding it like that, 30 seconds. Okay, and then this way as well. So you're going back this way and you're holding it down. 30 seconds. You're basically going to do 3 sets of 30 seconds for everything. And now moving on to isotonic exercise. So back to our little hammer. You're going to do the same movements, but this time you're going to go back and forth. You're going to do it 15 times as one set. Form supination, pronation. Then, with the water bottle, same thing, same movement. You're going to do wrist flexion 30 times. You're going to do 2 sets. And then wrist flexion 30 times. 2 sets. You might be wondering, why the socks? Well, here's the last one. You're going to work on finger flexion. So you're going to hold for 5 seconds and relax. Hold for 5 seconds, then relax. You're going to do that 5 times. That's all the exercise I want you to do. You want to do it as many times as you can within a week. At the beginning, it might be a little bit sore, but over time, it'll strengthen your muscle and hopefully prevent any further wrist injuries.